The next thing that I'll be showing you is to how administer a subcutaneous injection. In administering a subcutaneous injection, the equipments we'll be using are the following: a ampule. This should be the correct sterile medication. Of course, clean gloves, alcohol prep pad, sterile gauze, dry sterile gauze, alcohol for sanitizing, sterile tuberculin syringe with needle, and another extra needle. And of course, the medication administration record of the patient. So the first thing that we are going to do is to perform a hand hygiene. It's either to wash our hands or to sanitize them, and observe the appropriate infection control procedures. Then, we are going to prepare the medication from a vial or ampule for drug withdrawal. In administering medication, we must always remember the 10 rights. First is the right medication, right dose, right time, route, client education, documentation, right to refuse, right assessment, and right evaluation. In preparation, we must first check the medication sheet, check the label on the ampule carefully against the medication sheet to make sure that the correct medication is being prepared. Follow the 3 checks of administering medications. Read the label on the medication. First, when it is taken from the medication chart. Second, before withdrawing the medication. And third, after withdrawing the medication. Then, we must organize our equipments. In preparing medication from ampules, the equipments we'll be using are the following. Of course, ampules, gauze, alcohol prep, syringe, needle, filter needles, but since we don't have any available here in our house, in our community, I'll be using an extra syringe with needle, a medication sheet, and of course, a alcohol to sanitize our hands. So first, we are going to perform a hand hygiene. It's either to wash our hands or to sanitize them. Then, we are going to prepare the drug or the ampule for drug withdrawal. Next, we are going to flick the upper stem of the ampule several times with a fingernail. Then, we are going to place a piece of sterile gauze between our thumb and the ampule neck. But first, we are going to clean the neck of the ampule using the alcohol prep pad. Here's the neck. And then we are going to break off the top by bending it toward us to ensure the ampule is broken away from ourselves and away from others. After breaking off the top of the ampule, we are now going to dispose the top of the ampule in the sharps container. Then, we are going to place the ampule on a flat surface and start to attach the filter needle to the syringe. We must also remember that we can only touch the plunger flange and the barrel part of the syringe. Then, we are going to remove the cap of the filter needle and insert the needle into the center of the ampule. After attaching the filter needle, so we are now going, and after removing the cap from the filter needle, now we are going to withdraw the amount of drug required for the dosage. So our order says 1 ml of medication. Now we are going to dispose the filter needle by placing it in a sharps container and replace the filter needle. Tighten the cap of the hub of the needle and push solution into the needle to the prescribed amount. Next, we are going to introduce ourselves and verify the client's identity. After, we are now going to provide privacy for the client. It's either to close the door or to close the curtains. Now we are going to explain the purpose of the medication, including the relevant information about the medication, and we are going to select a site free of tenderness, swelling, scarring, itching, burning, or localizing inflammation, and one that has been frequently used. So, as if this is our selected site here, the next thing that we are going to do is to put on clean gloves. Then we are going to cleanse the site, this one. We are going to clean the site with an antiseptic swab and start at the center of the site and clean in a widening circle to about 5 centimeter or 2 inches. Allow the area to dry after cleaning. Next, we are going to remove the needle cap by pulling it straight off. After removing, we are going to hold the syringe between our thumb rather, and forefinger of our dominant hand. So thumb and forefinger with our dominant hand. Then we are going to pinch the skin with our non-dominant hand. So as if this is a skin, I'm going to pinch it. Then now we are going to inject. After we inject, we are going to release the skin and grasp the lower end of the syringe with non-dominant hand and position dominant hand to the end of the plunger. Do not move the syringe, and always remember to move the syringe. So here, our non-dominant hand and our dominant hand. And now we are going to inject the medication. Okay. When we are going to pull back on the plunger to the ascertain that the needle is not in a vein. Okay. Pull back. And we are going to quickly withdraw the needle while applying pressure with antiseptic pad. Okay, so there. And then after, we are going to assist the client to a comfortable position, discard the uncaped needle and syringe in a disposable needle container, and we are going to remove our gloves and wash our hands. And lastly, we are going to document all relevant information of the client.